Hello, and welcome to the George and Fahey Center for Healthcare Innovations May Patient Engagement Lunchtime Learning Series for the 2025-2026 academic year. My name is Maxa Sawyer, one of the patient engagement consultants on the engagement team at CHI, and I will host the session today. Today's session is Evaluating Patient and Public Engagement in Health Research and Health Systems with Ashley Struthers, Manager and Research Associate in Evaluation and Quality Improvement, and Carolyn Shimon, Patient and Public Engagement Lead, both for the Center for Healthcare Innovation. Now, I would like to welcome the speakers who will introduce themselves and share with us their knowledge. Ashley?
Thanks so much for that introduction, Maxa. It's really nice to be here today with Carolyn to talk to you all about patient and public engagement and, the evaluation of it. So I'm going to start off with our land acknowledgement. So CHI offices are in the ancestral and current day lands and waters of the Anishinaabe, Inninewak, Unshinewak, Dakota Oyate, and Denisoline, and on the national homeland of the Red River Métis. In northern Manitoba, we acknowledge the ancestral lands of the Inuit and gratefully acknowledge our water is sourced from Shoal Lake 40 First Nation. We respect the treaties that were made on these lands. We acknowledge the ongoing harms to Indigenous communities, including by research and healthcare systems, and we dedicate ourselves to partnering with Indigenous peoples to identify the resulting inequities, as well as the many strengths, knowledges, and opportunities within communities. We are committed to ongoing learning about how to do our work in a meaningful way through listening, reflecting, reciprocity, and relationship building. I spent some time this morning reflecting on this land acknowledgement. Our team, the evaluation team at CHI, developed this land acknowledgement together. As a team, we are committed to ongoing learning. We have all taken the OCAP course, and we are going to be working through We Will Take Good Care of the People, Manitoba's new Indigenous Cultural Safety Training course, as a team over the summer. We have dedicated reflection time built into our day-to-day work to come together as a team and talk about how to apply what we learn to our work and reflect on our successes and challenges. So I'm Ashley, and I lead the evaluation team here at CHI. We're a 9-member team focused mostly on evaluations within the healthcare system, and I'll pass it over to Carolyn.
Hi, my name is Carolyn Shimon, and I'm the Patient and Public Engagement Lead at the George and Fahey Center for Healthcare Innovation and Shared Health. And in this role, I help lead the development and implementation of patient and public engagement strategies across both health research and provincial health systems. And I have a pleasure of working with a wonderful team. Thanks.
Thanks, Carolyn. So to just give you a quick overview of today's session, we're going to talk about what evaluation is. So just kind of a broad definition of evaluation to get us all on the same page, and then dive into why you would want to evaluate patient and public engagement and what to evaluate. We're going to cover some evaluation frameworks and tools. You might be familiar with some of them might be new to you, and how you can use these to help guide your evaluation. We'll talk a little bit about methods for evaluating engagement and how to embed evaluation into your practice. So by the end of the webinar, you should be able to describe what evaluation is and why engagement should be evaluated, describe what aspects of engagement to evaluate, identify some commonly used frameworks and tools, select appropriate evaluation approaches for different contexts, and plan your next steps to embed evaluation collaboratively with patient and public partners. So here's the definition of evaluation. This is the definition from the Canadian Evaluation Society, and this is the definition that our team uses. So it says evaluation is the systematic assessment of the design, implementation, or results of an initiative for the purposes of learning or decision making. And I'd like to just highlight a couple little parts of this definition. So the first is that evaluation is a systematic process. Throughout the webinar today, I'll share more about the evaluation process and specifically the process that our team here at CHI uses. The other key part of the definition is that evaluation is intended to be used for learning and decision making. So the focus of any evaluation should be on utilization. So throughout the process of planning the evaluation, doing the evaluation, sharing evaluation findings, we should always be thinking about how to ensure that the evaluation is useful, how it can be used for learning or to inform key decisions that need to be made. So this is a snapshot of the process that we follow for evaluations. As you can see, collaboration and engagement are at the center of our evaluation process. Our evaluations are always guided by a working group who we collaborate with to do the evaluation and ensure that it will actually be useful for them for learning and decision making. So starting at the top of the process, we work with the working group to understand the initiative, whether it's a health system policy or a patient engagement activity. We then collaborate to create the plan for the evaluation, including clarifying the purpose of the evaluation and the evaluation questions and methods. Once the plan is ready, we gather knowledge or data, analyze and interpret the data, and share the story, including any recommendations that come out of the evaluation. A final step our team does is to reflect on our evaluation process as a team and also to meet with our partners to talk about how they have used the evaluation findings. One of the first steps to ensuring an evaluation will be useful is clarifying the purpose of the evaluation. This is the reason you are evaluating, the why. As the definition of evaluation implies, the purpose should relate to learning, things you want to learn about to improve the engagement or future engagements, or it should focus on decision making. So what decisions do you need to make about the engagement? Here are some common reasons to evaluate engagement. So firstly, evaluation can help you understand whether the engagement was meaningful. It can help demonstrate the impact of research or health systems decision making. It can improve future engagement practices. It can ensure accountability to communities and partners. And it can also be used to generate and share knowledge about good practices. So if you've done engagement really well, you can share your success with others so that they can learn from it and replicate it. At CHI, our team works across both research and health system contexts. So our approaches to evaluation of engagement need to be flexible. While in research, engagement evaluation may focus on how engagement contributed to improvements to study design, recruitment, or knowledge translation, evaluation of health system engagement may focus more on how engagement contributed to improvements to service design, or to quality improvement, or to the development of a new policy. A key step in developing the evaluation plan is to develop the evaluation questions. These are the high-level questions that the evaluation intends to answer. Keep in mind, these are different from the questions we might ask evaluation participants during an interview or focus group. The questions asked during an interview or focus group or on a survey help us to collect the data we need to answer our evaluation questions. So once we've clarified the purpose of the evaluation, we can move on to developing these guiding questions. When we talk with people about the evaluation questions for patient engagement, the conversation can be divided into two parts. Evaluation questions that relate to the engagement process, or how the engagement was done and how people felt about that, and evaluation questions about the outputs or outcomes of the engagement. So what products or decisions were influenced, or what changed because of the engagement. Okay. when we're thinking about developing the evaluation questions and clarifying what we want to learn, there isn't really a single approach. There are lots of conceptual frameworks and tools out there to help guide you as to what to evaluate and what the evaluation questions could be. There are also some tools that can help you collect data or report on your findings, and we'll return to those later. But we will next look at some of the conceptual frameworks and how we use them to guide the development of the evaluation questions. So here are some of the conceptual frameworks. So the peer framework, CIHR's patient engagement framework, IEP2, valuing all voices. Some of these might be familiar to you, some of them might be new to you. I'm going to just turn it over to Carolyn now, and she's going to walk us through some of these frameworks.
Thanks so much, Ashley. So I'm going to talk a little bit about some of the conceptual frameworks and engagement spectrums and values lenses that might help to inform your evaluation. And the first one, oops. So the first one is one that folks in the health research side of things might recognize. So the Canadian Institutes of Health Research Strategy for Patient-Oriented Research, otherwise known as the acronym SPORE, has an engagement framework that's seen a lot as the foundational values framework for engagement in health research. So it provides a strong foundation for thinking about engagement evaluation in health research. It focuses on 4 core values: inclusiveness, support, mutual respect, and co-building. And what this framework really asks us to evaluate is the quality of the partnership itself. So were diverse perspectives meaningfully included? Did patient partners have the support they needed to participate fully? Did they feel respected and able to influence decisions? Overall, the SPORE framework really shifts evaluation beyond participation numbers towards that quality and integrity of engagement relationships. The next one is, some folks might know, it's an American one, but it's still used here sometimes in engagement and health research. That's the Patient-Centered Outcomes Research Institute, or PCORI's engagement rubric. So while the SPORE framework identifies core values, the PCORI engagement rubric helps us operationalize what meaningful partnerships look like in practice. So it emphasizes things like reciprocal relationships, co-learning, partnership, trust and transparency. So evaluation questions here would focus on things like shared decision-making, role clarity, mutual learning, and whether communication was open and accountable throughout the process. And overall, the framework helps translate engagement values into concrete partnership practices that can be evaluated. The next one is the Center of Excellence on Partnership with Patients and the Public. Their framework called the Learning Together framework. The Learning Together framework can be seen as kind of that systems transformation framework. So it expands evaluation beyond individual projects to include things like equity, sustainability, and systems transformation. So a key contribution of this framework is its focus on long-term relationship building and broader impact of engagement on research culture and systems change. And it also places a strong emphasis on equity and reducing barriers to participation. Overall, it encourages a more holistic and transformative approach to engagement evaluation. And then there's Healthcare Excellence Canada's Patient Engagement Framework. This framework is especially useful in health systems improvement and quality improvement contexts. So one of its key ideas is that engagement exists on a continuum. An evaluation should examine whether the level of engagement matches the goals and decisions of the project. And it also emphasizes things like authentic partnership and co-design within real-world improvement work. So evaluation can focus not only on participation, but also on whether engagement contributed to practical changes in services, systems, or patient experiences. And then we have the International Association for Public Participation spectrum, which I feel like both on the health research side and the health system side, we look at quite a bit. And you can see this as kind of the influence and decision-making framework. So it helps clarify different levels of participation and influence, ranging from informing to consulting to collaborating and empowering. And what makes this framework particularly useful for evaluation is that it encourages us to examine whether the level of engagement was appropriate, clearly communicated, and aligned with what partners were promised. So in other words, did the engagement approach match the goals, expectations, and actual level of influence within the project? And then we have the Valuing All Voices framework, and we can kind of see this as a ethical and trauma-informed lens. And so the Valuing All Voices framework kind of shifts evaluation towards questions on safety and equity and ethics and power. So rather than simply asking whether engagement occurred, it asks how engagement was experienced. So did partners feel emotionally safe? Did they feel respected and genuinely heard? Were power dynamics acknowledged and addressed? Did lived experience meaningfully shape decisions? So this framework reminds us that meaningful engagement must also be relationally and ethically safe. And then it's always really important, rather than only measuring participation numbers, to have an equity-focused evaluation, asking deeper questions around who participated, who's missing, whose voices carried more influence, and were barriers to participation actively addressed. And ultimately, equitable engagement is not just about inviting people into the room, it's about creating conditions for meaningful and safe participation. And then it's also important to take a look at equity and outcomes. So beyond evaluating equitable processes, we also need to evaluate whether engagement contributed to more equitable outcomes. So did engagement shape decisions, priorities, policies, research, or service design in meaningful ways? Did it contribute to more inclusive research or more accessible and responsive systems of care? This shifts evaluation from asking whether engagement happened to asking what changed because of engagement.
Thanks, Carolyn. Before I move on to talking a little bit about evaluation tools here, I'll just say, so that, gave you some frameworks to consider in your evaluation. You might have thought, oh, this is great to have all these options, or oh my goodness, how do I pick between these options? And so I don't have any real concrete advice, but some of the things that I would consider or think about in that is that you may have used a framework to guide the development of your whole engagement strategy, and that's probably a good one to choose for evaluation in that case. Did we achieve what the framework kind of set out to do? And in other cases, it's really just looking at, which framework fits best with your approach to engagement, which one you think kind of looks at or includes most of the evaluation questions and what you need to answer and what's going to be useful to you moving forward. Sometimes in evaluation, we might use more than one framework. So we might combine them just to help us think more broadly about something, but there might be one framework that just meets all of your needs and you can keep it simple. So once we've developed the evaluation questions, we move on to developing the methods and really matching those methods to the questions that we're asking. So there's some common tools that can be used for evaluation of engagement activities, and Carolyn and I are gonna chat about a couple of those. The first one is PEPIT, and PEPIT is probably the tool that I am most familiar with. It's the one that I've used most often. It's a set of questionnaires you can use to collect data for evaluation of engagement in both research and health systems. There's surveys that they've developed they're surveys for 3 different groups. So engagement participants, the engagement team members, and organizational leaders. So for example, in the participant survey, questions focus on communication and supports for participating, safety for sharing lived experiences and perspectives, and impacts and influence of the engagement activity, in addition to some measures of overall satisfaction with the engagement. And I'm going to pass it over to Carolyn again here for a minute.
Hi. So the other one, this one's used more in research, is the Patient Engagement and Research Scale, or PEERS framework, or PEERS 22. And the PEERS framework and PEERS 22 move us from the conceptual, of course, into a structured measurement tool. The PEERS framework focuses on how engagement is experienced by patient partners, so including areas like support, team interaction, feeling valued, and the broader research environment. And PEERS 22 is a validated tool that helps measure the quality of engagement experiences more consistently and rigorously across research projects.
Thanks, Carolyn. So as with evaluation in general, evaluating engagement can include both quantitative methods like participant metrics, closed-ended rating scales and on surveys, or qualitative methods. So interviews, focus groups, reflection sessions, open-ended survey questions. Most of our evaluations use a mixed methods approach, so often combining surveys and metrics with interviews or focus groups that allow us to dig deeper into the experiences of engagement. Combining these methods also allows us to triangulate between the data sources and develop a fuller, more well-rounded picture of the initiative. And I think I'm turning it back over to you again, Carolyn.
Oh, it's me. Thanks so much. An important thing, of course, and I know Ashley mentioned it before, having partners involved. And so it's really important to make sure that we engage people with lived and living experience in the design of evaluations as well. So rather than evaluating engagement on patient partners, really evaluation should be done with them as well. So patient and public partners can help in a myriad of ways. They can help define the evaluation priorities. They can help you co-design the tools. They can even be involved in the conduct of evaluation. So sometimes we have peer interviewers or peer facilitators. They can also help you in interpretation of the findings, so they better reflect the lived experience. And then also, how do we share the results? So involving partners in evaluation throughout strengthens both the quality and the credibility of the evaluation process itself. And then a special note on the importance of using a trauma-informed lens when evaluating engagement, particularly in health research and health systems work, where people may be sharing experiences of illness or discrimination, stigma, or harm within the healthcare system. So a trauma-informed approach really recognizes that evaluation itself is not neutral, that the way we ask questions, collect feedback, interpret stories, and share findings can either support psychological safety or unintentionally recreate harm. So one consideration is always emotional safety, so making sure that participants feel respected and supported and able to choose how much they wish to share, that it's always voluntary and there's ongoing consent and flexibility in how folks participate, whether through surveys or conversations, written reflections, or virtual options. And also the importance of avoiding extraction of personal stories. So lived experience should not be repeatedly requested without clear purpose and support throughout. And trauma-informed evaluation also involves respectful interpretation of feedback. So recognizing that experiential knowledge is a valid form of expertise and considering the broader context and power dynamics surrounding people's experiences. And then the final piece is that loop back piece. So sharing back with folks is a really important way, part of ethical and relational accountability. So it helps build trust and demonstrate how partners' contributions informed learning or change.
Hey. So once the evaluation plan has been developed and carried out, so the data has been collected, you've done the analysis, you've interpreted the findings, the next step is to share and use the findings. So it's really important that at the onset, when you first start thinking about the evaluation, to also start thinking about how you're going to share it. So who the findings should be shared with and the best way to share them. So the evaluation participants are a primary group to include in the step of sharing, but you should also consider who else would benefit from knowing about the evaluation findings. So evaluation findings can be used to improve engagement practices, to inform policy and funding decisions, to demonstrate value to organizations, and to strengthen partnerships. And I'm sure you can think of other uses as well, and they'd be matched to the purpose of your evaluation. But this step is sometimes missed when we evaluate. I'd say maybe sometimes is an understatement. It's often missed, and it's really the key step. What was the point of doing the evaluation if you're not going to share and use the results? So this is the Grip 2 reporting checklist. So it's not really an evaluation tool, it's a reporting tool. And it can help researchers to just be sort of concise and know what to include in their reporting. So why the engagement occurred, how partners were involved, and what influence the engagement had. And so doing the evaluation can help you to answer and fill in some of these key parts of the GRIP reporting checklist. Okay, so in summary, so we've covered the evaluation process and the steps involved. So ensuring that it's co-designed with evaluation partners, planning the evaluation, so defining the purpose and the evaluation questions, selecting tools and methods, gathering and analyzing the data, sharing the findings, using the recommendations, and reflecting on the process. Like good engagement, good evaluations of engagements are collaborative, so they involve patients and others in the process. They are purposeful, so the purpose is clearly stated and ensures the evaluation will be useful for learning and decision making. They typically use mixed methods to get a holistic understanding of the engagement. They're an opportunity to reflect on the engagement, but also on the evaluation, and they are focused on learning and improvement. And finally, they are equity informed and can help to demonstrate who the engagement worked for, what groups it may not have worked for, or not worked as well for, and what could be done better moving forward or in the next engagement. There are some common pitfalls in evaluation of engagement, and we've touched on these throughout the presentation, but to build on some of them. So one of them is a common pitfall is only measuring satisfaction. So this really limits your opportunities to learn from the evaluation. It tells you whether people were satisfied, whether they liked it or not, but doesn't really give you much understanding as to why or what their experience was. So applying one or other of the frameworks we've talked about today will help you to develop a more full evaluation that will be more useful for learning and improvement. Often looking at the process of engagement is easier than looking at its impacts, but both are really important to truly understand the engagement initiative. You might have to think about the timing of your evaluation a little bit. Some impacts are quite immediate, and some take a longer period of time before you'll really see them. Carolyn talked about this, but often evaluations can simply be extractive. They take knowledge and gather participant experiences, but don't give anything back to participants. So evaluations can move away from this approach by providing capacity building opportunities to participants throughout the process, but also ensuring that you complete the full evaluation process. So in other words, making sure that you don't stop after the step of analyzing and interpreting the findings, and that you keep the process going to share the findings and reflect on the evaluation process and how the findings and the evaluation were used. Finally, ignoring power dynamics within the evaluation team and with participants can also limit the impact of evaluation, as can treating evaluation as an afterthought or a checkbox. So start thinking about and planning the evaluation when you start planning the engagement. So just to summarize a few key takeaway messages. Evaluation is meant to strengthen engagement practice, so to really highlight what went well and opportunities for improvement so that over time we can get better and better at doing it. It's really important to look at the process, so to make sure that people's experience was good, but also that there were outcomes, that there was an impact from doing the engagement. There are multiple frameworks to kind of guide you in thinking about what you should evaluate, and there are some tools out there as well that can help you to collect and gather data for your evaluation. And ideally, patient and public partners should be involved in planning and even doing, interpreting, analyzing the evaluation findings. There's a few resources here, ones that we've talked about today, and I'm just going to pass it back over to Carolyn.
We kind of came up with a final reflection question for our audience. And that question is, what is one step after listening to today's session you will take to incorporate evaluation into your engagement work? If you have some examples or thoughts on that, please feel free to write that in the Q&A section.
Thank you so much, Carolyn and Ashley. We'll give a minute to let everyone reflect and to write down one step they will take. And oh, I have one answer. I will review the Learning Together framework given its long-term focus. Thank you. Oh, a lot are coming. Oops. Ask partners what they are hoping the outcomes and engagement activity will be. Thank you. Have a patient, oops, I will have a patient engagement event. Oops, sorry. Answer live. I recently did a workshop on PEPIT, so I will go back and review again and then form a team to look at the questions we would like to select for eval at our organization. Thank you. Thanks to CHI for this. Always great info and great to see you again. We are developing physician engagement guidelines for the health system, so this is helpful and timely. Thank you. Very helpful. Thank you so much. Could you, oh, the slides will be shared. Thank you for the clarification on the analytical methods, including both quantitative and qualitative approach. And we have, I think I need to be a little bit more active with making notes during the data collection stage so that I can be a better participant in the reflection and feedback stages. And then we have planning ahead, planning evaluation of P at the same time as planning the overall project. Thank you. We also have in the question of whether or not the slides will be shared. The slides will be shared as soon as the video is ready. You will get an email with the video, with the slides as a PDF, and as well as information about our next PELL session in June. We have a question saying that this strikes me as an involved process that it sounds like they would like to do. They have a patient engagement coming up soon that I just designed a survey feedback for after. Would that still count for evaluation? I still plan on evaluation for patient engagement plan for, sorry, I just designed a feedback survey to use afterwards. Does this account as evaluation as it doesn't use any framework? If not, is it too late to plan a proper evaluation for next week's event?
Do you want me to jump in there, Maxa? Sure. I think that's a good question. And I think what we didn't really touch on throughout this today is sort of the feasibility piece, right? Like, what kind of budget and resources do you have for evaluation? Because evaluation can be quite resource intensive, but also it can be something simpler, right? And it's really to meet your needs and to meet, what's feasible for you. So I think it's great that you have a survey designed already and ready to go for your session next week. Like that is evaluation. I know we talked about using mixed or multiple methods in an ideal situation, but like this is really great. And I think you might in the next week want to look over some of those frameworks that Carolyn presented and see if there's a question uh, that comes to mind after looking at those that you might want to add to your survey, but I don't think you need to go back to the drawing board or stress out too much about trying to get something done in the next week. As we sort of tried to reiterate, thinking about evaluation, you need some time to think and plan. So I feel like you're in a pretty good spot here. Carolyn, do you have anything you would add?
Yeah, no, I think that's definitely. And I think there's another question as well that talks about like smaller projects when you don't have a big budget, how do we do evaluation? And I've seen sometimes with smaller like research projects where they really have the funding to do the the research project piece and they don't have a lot of time. They've done things like built in a little subcommittee of the team with a few patient partners and researchers to co-develop a survey or even one of the engagement activities on your advisory group is to really talk at the very beginning about what outcomes are most would mean success to you and kind of having those, so building it kind of into the engagement itself so that it's not a separate huge piece that you're thinking about outside of your engagement within research or health systems projects. So kind of just building it into your meetings can help sometimes so that it's a little less cumbersome. Um, I heard there's a team once that ended up doing peer interviewing where they essentially came up with questions and then they interviewed each other about the engagement process. So just different ways that might not be as timely or involve more budgeting and so on.
Yeah, I like that a lot, Carolyn, and like just trying to build it in as much as you can to your
Yeah,
process, like this person in this question has done. I'm doing the engagement and I
yeah.
have an evaluation form, keeping track of the changes you make to your research project or to your health system initiatives as you go along so that you have that list at the end and can show, look at all the things that we've done differently because of this engagement. So just building things in and doing them along the way rather than waiting till the end.
Thank you. We have another question that asks, for an organization intending to evaluate engagement with external stakeholders, what approach would you suggest the organization take? Just to provide a little bit of context, you can't request the stakeholder to complete a survey. Both, both there is correspondence between both parties. Can this data source be used to learn about the engagement?
Hmm.
Just trying to think about this to make
Yeah.
sure that I understand here. Um, I know so I'm not sure that I'm gonna get this right,
Yeah.
but one of the challenges we often have in evaluation is getting people to participate in the evaluation. Um, people are super busy. You send them a survey. They don't have to do it. They don't need to participate. So a couple things, strategies that we usually that we try to do. One, if there can be some kind of incentive for participating, sometimes this could be something like entering a draw, could be one way. Sometimes there might be compensation for their participation. Sometimes it's just in your communication about it. Making a really good case for why it's important and what, if the participant isn't going to get something out of it, like what are you going to learn and how are you going to use the information? So I'm not sure. Carolyn, do you have a different interpretation of this?
Yeah, no, I think you definitely nailed those points of getting, and I'm thinking, like, if you are doing an engagement with external stakeholders, the engagement event itself, making sure that a part of that is the evaluation at the end, or like some way of making it more, yeah, tangible, that everyone's together eating food, or maybe you can, yeah, find time within there to get people to answer. Oh, can
We have a follow-up
correspondence?
asking, can a correspondence between both parties be used for evaluation under qualitative method?
Okay.
Hmm.
So this is sort of a more difficult one to answer. I think it depends on the context and what you sort of talked about with those partners. I think it certainly can be used. I would consider we would maybe call that document review, which we haven't talked about throughout this. That was a bit of a miss on our part. So
I forgot about
great
that.
point
Yeah.
for bringing this up. But I think especially if you sort of let people know that you're going to use the correspondence in that way, it is a really great source of data to just go back to the correspondence, to your meeting minutes, notes, all that kind of stuff to help you answer the evaluation questions.
Yeah. I forgot about document review.
Um, Thank you for this presentation to either presenter. Oh, the person who asked that question said thanks. So I'll acknowledge that. Thank you before I move on to the next um, answer. Okay, so thank you for this presentation to either presenter. Do you share an example of an evaluation you've done that involved partners, example, peer facilitators? I'm curious to know more about how this might look in practice.
I, yeah, I'm not sure if you have, Ashley.
Why don't you start us off here,
We've
Carolyn?
had a few ones in research where we've had peer interviewers. Some of the things that are required in that is to do a little bit of an orientation for potential peer interviewers who are interested in learning this kind of skill. So doing a little bit of an orientation session about how we do interviews, what to expect. Some of the big things that you always want to look out for is people who have lived experience. They may, when interviewing a peer or someone with the same lived experience, if they are interviewing them, perhaps there may be a moment where they feel triggered. And so really making sure you're using a trauma-informed approach so you have some resources on hand should they need to, maybe even doing co-interviewing where you have an evaluator with the patient partner, so the two, that there is that support just in case that happens. Those are, yeah, I think what some evidence has shown is that having peer evaluators can lead to really rich data because folks may feel more comfortable speaking to them about their experience and engagement than, say, someone who doesn't have the same lived experience. So there can bring that richness. The biggest thing is just to make sure that you're supporting your peer facilitator or peer interviewing along that way, and letting them know that at any point in time they can take a step back or take a breather, recognizing the impact that some of it can have.
I'm thinking because one of the things I just did was review the methodologies handbook that's on the CHI website. Perhaps could it be a good technique to provide safe trauma informed care if you did an inside circle, outside circle, where people could switch roles and exit the circle when they feel they need to take a break and enter the circle when they feel they want to share more.
Yeah, that's always a good engagement technique. Yeah, to kind of allow people to pick and choose.
I'm going to end this part of the session a little bit early because Carolyn has something else
Oh,
she would like to share. Before you share that, Carolyn, I just want to thank you and Ashley for sharing with us so much of your knowledge and sharing how engagement and evaluation can work together to strengthen each other. You will receive a follow-up email with further information on how to access the slides and recording when available. We also welcome your feedback for the session, first with a poll that will come once you exit. Oh, sorry, not with a poll, with a short survey that will come following the closing of the webinar. We would like you to we would like to invite you to join us for June's PELL, Advocacy and Collaboration, Navigating Roles in Patient Partnership, which will be a panel discussion. The panelists will be members of CHI's collaborative partnership. And in this session, we will explore the dynamic tension between advocacy and collaborative engagement. Through lived experiences, patient partners will share how they navigate these roles, what supports or hinders their contributions, and how organizations can create environments where both advocacy and collaboration are valued and possible. Participants will gain practical insights into recognizing, supporting, and intentionally designing for these roles in patient engagement work. So I look forward um, to that. Now we have something that Carolyn would like to share.
yay. Thanks so much, Maxa. I just wanted to share for our is that on the screen there? Okay. I wanted to share for our Manitoba folks who may be doing health research and they want to engage patient and family partners at the very, very early stages of research. So at the priority setting, developing the research question, developing the design of the research project, and developing grant applications. Our award called the Preparing for Research by Engaging Patient and Public Partners, otherwise known as our PrEP Award, at the Center for Healthcare Innovation will be launching tomorrow. So keep an eye out on the CHI website. We'll make sure, maybe I can even have Maxa include the link when they send out the follow-up to this webinar to all of our attendees. But exciting news, it's a great little funding award of $4,000 and it helps so that you can compensate people with lived and living experience for their engagement at the very, very early stages of your project. So keep an eye out for that. Oops.
Thank you, Carolyn. Would you like to open the floor if anybody has any questions?
Oh yeah, does anyone? We will have an information session in a couple of weeks' time for those who are thinking about applying. And also they can always email us at our CHI partners at umanitoba.ca if they have more questions.
How many people usually apply for this?
It's a pretty big, we get a good size, it's pretty competitive, but we get a good size of folks who are interested. And we've now funded over 55 awards across Manitoba, and quite a few of our award winners have gone on to receive larger CIHR grants later on to help fund the entire research process. And they continue to engage people with lived and living experience throughout the entire research process. So it points to the benefit of engaging people with lived and living experience at the very, very early stages so that your research actually reflects the needs and values of folks with lived and living experience.
We have a hand raised, but in order to answer the question, you have to in order to hear what you have to do, you have to write it in a Q&A because unfortunately we can't unmute. Can master's and PhD students apply for this?
Absolutely. We've had a number of students who have applied. So yes, health researchers, students, even community organizations that are planning on doing research can apply for this award.
And do they have any obligation after receiving the award to CHI?
I know why Max is asking this. So the award is 18 months long. And at the end of your award, we ask, first of all, we have a small little report back that we'd love to hear what you've done, but we also ask you to come and present at this lunchtime learning series about your engagement and everything you learned and successes and challenges. We'd love to hear from award winners.
And it sounds like this award helps answer the question, how do you do patient engagement when you don't have funding for the project yet?
Yes, that's a big one. The award came out of a survey we did of Manitoba researchers and students a while back, and what we found is that folks often felt like they could only engage once they received a larger grant, and they couldn't engage people with lived and living experience at the early stages. So this ends up helping you both. There's a amount of funding, but we also provide kind of ongoing advisory and consultation support throughout so we can help you through the journey of engagement in your project.
And just looking through the past winners, it looks like there's a wide range of people just starting off in their career, people with prestigious backgrounds,
Yeah.
students, MDs, PhDs, people who are working for organizations. So it really sounds like the winners are reflected in this diversity.
Oh, absolutely. Yeah. Everything from clinician researchers, students, community org researchers. So definitely there's a variety of folks who win the award every year, and it's always exciting.
And we can email Carolyn, if we have any more questions.
Absolutely. And I think, Maxa, what we'll make sure is that anyone who's attended attended the session will send out the prep release tomorrow so they can learn more about and find our website and learn more about the award.
Great. So look out for that in your inbox. And that's one of the benefits for signing up. You get early access to this award
Before anyone else.
before anyone else. Hot off the presses. Well, Carolyn and Ashley, thank you again once more for sharing with us all your wealth of knowledge. Thank you to our audience for taking the time to join us. Some of you are coming here at your lunch hours. Some of you are coming here during your regular hours. Thank you to all of you. We hope that you are walking away encouraged to further explore the possibilities of patient engagement in your work. Thank you, and hopefully we will see you in June or
Thanks.
your prep award application. Thank you.
Thanks so much.